Hi there, welcome to Study Race. Today, we are gonna learn about syphilis, which is a bacterial disease, usually spreads by sexual contact. This disease starts with a painless sore typically on genital areas, rectum, and mouth. Syphilis is actually a chronic infectious disease caused by Treponema pallidum, usually transmitted through sexual intercourse, which is often congenital, and affecting almost any organ or tissue in the body. It is treatable but can be fatal if not treated and cause disability, neurological disorder, and even death. The causative organism of syphilis is Treponema pallidum, which somewhat looks like this. This bacterium penetrates skin or mucous membrane. Its incubation period ranges from 10 to 90 days. Mode of transmission of this disease include sexual contact, contact with infected blood, contact with body fluids of infected person, shared needles, vertical transmission, mother to child via breast milk. Now let's take a look at types of syphilis. There are 4 stages of syphilis, that are primary, secondary, latent, and tertiary, which is also called neurosyphilis. In primary syphilis, one or more small, painless sores in or around genitals, anus, or mouth called chancres appears. In secondary syphilis, symptoms may include rough reddish-brown rashes, swollen lymph nodes, fever, sore throat, hair loss, head and body ache, extreme fatigue. If syphilis is not treated in this phase, the infection can get worse. In latent syphilis, the syphilis bacteria are still alive in body, but there are no symptoms. This phase can last for years. Also, the infection is not contagious during this phase. Tertiary or late syphilis stage begins when symptoms from secondary stage disappear. Syphilis is not contagious at this point, but it starts to affect organs and can lead to death. Symptoms at this stage include problems controlling muscle movements, numbness, vision problems, dementia, confusion, headache, and seizures. Now, let's have a look at pathophysiology of syphilis. Treponema pallidum infection spreads. Primary syphilis phase starts, in which chancre appears for 3 to 6 weeks and heals without treatment. After that comes the secondary syphilis, in which there is general yeast enlargement of lymph nodes. There may be a low-grade fever, malaise, fatigue, and mucosal rashes. After secondary phase, there is latent phase, which further may progress to asymptomatic syphilis or reach tertiary syphilis phase. In this phase, gumma may appear. There may also be neurological complications. Diagnosis of this disease can be done through gram staining, bacterial culture, or MRI. Treatment of syphilis is very simple. If it gets detected in early phases, penicillin may be given. If the person is allergic to penicillin, doxycycline may be given. If it is identified in later stages, injection of penicillin may be given, and surprisingly, if you mistakenly miss a dose for a period of 10 to 14 days, you don't need to restart the entire course. This video is about syphilis, a common sexually transmitted bacterial infection. It covers the symptoms, causes, and treatment of the disease, including its potential health complications. The video also emphasizes the importance of prevention through safe sex, regular testing, and timely treatment. Overall, it aims to educate viewers on syphilis and its consequences, encouraging them to stay informed and seek medical advice at the earliest. At last, thank you everyone.